The premier event for infection prevention and control is coming to San Antonio this June. APIC's annual conference brings you the latest research, innovative products, and practical knowledge to help you prevent infection. From inspiring keynotes to thought-provoking panel discussions, APIC 24 curates an extraordinary platform for knowledge exchange. Meet IPs from around the world who face the same daily challenges as you. If you work in infection prevention and control, you don't want to miss this event. Learn more and register to join us, in person or virtually, at annual.apic.org.
You are listening to the 5-Second Rule podcast presented by APIC, the Association for Professionals in Infection Control and Epidemiology. This podcast is produced by the APIC Communications Committee and is intended to be a conversation between our hosts and professionals practicing in the infection prevention and control industry. You will learn and be entertained, but most of all, we hope you will be inspired by our community and the work of our peers. And now, on to the show.
Welcome to the 5-Second Rule podcast. We are your hosts. I am Lerenza Howard, and my preferred pronouns are she, her.
Good morning, and I'm Kelly Holmes, and my preferred pronouns are also she, her. We are joined by several guests today, and the first one I'd like to introduce is Sandra Callery. Sandra is the immediate past president of the Certification Board of Infection Control and Epidemiology, which we all know and love as CBIC. She's been involved in research and publications regarding disease transmission, management of patients with antibiotic-resistant organisms, emergency preparedness, and most recently, the value of certification for the infection control professional. Welcome, Sandra.
Well, thank you very much. It's great to be here with you.
Yes, and definitely we have today with us Dr. Tiffany Wiksten as well, who has been a nurse for over 20 years and has worked as an IP for over 10 years. She is a member of the CIBIC board and also is a subject matter expert at the Joint Commission. Welcome, Dr. Tiffany.
Thank you so much. It's an absolute honor to be here.
So I know that CIBIC is celebrating a major milestone in which they're celebrating their 40th anniversary. And initially, the primary certification for CIBIC is the CIC. So Sandra and Tiffany, can you expound upon the certification offerings that CIBIC now has for infection preventionists?
Yes. We are excited to be celebrating this milestone, and it really allows us an opportunity to reflect on what is the actual purpose of certification, which is really to protect the public through some sort of standardized measurement of knowledge for infection prevention and control. And we did review our mission and our vision within the certification board, primarily that we are here to provide pathways to assess and maintain infection prevention competency. I mean, we have a broad vision about healthcare without infections. So this is really where we want to go, providing new pathways. And that actually allowed us to look at what those pathways might be. And Tiffany can tell you a little bit more about some of those new certifications.
Yeah, absolutely. Thanks, Sandra. So, we're all familiar with the traditional certification in infection control that many of us have taken over the years. But we're also very excited to really discuss the AIPC, which is the Associate Infection Prevention and Control entry-level certification exam, as well as the long-term care certification in infection prevention. So I'm gonna talk about the AIPC, and then I'll toss it over to Sandra. So the AIPC is an entry-level certification examination, and really it's kind of that stepping stone, right? It was first identified as a stepping stone to those who perhaps were interested in infection prevention and control, and wanted to either demonstrate to their employers their commitment to learning infection prevention and control, or come in with some additional qualifications. But it's also a stepping stone to the CIC, because what it really helps is to demonstrate basic infection prevention competency. So what we've seen over the last year or so, or last period of time since it was first introduced is that there are other people interested in getting the AIPC. So people who maybe don't hold a traditional infection prevention and control title, but maybe have the role in their organization. Maybe the focus of their job description is more administrative, and they have some basic infection prevention requirements for their job. Or maybe they work in a non-traditional setting and basic infection prevention is really what they need to ensure that their populations are safe.
Oh, yeah, that's great, Tiffany. A very good point, because it has always traditionally been kind of a catch-22. Like everybody wants to hire you if you're certified, but you can't take the test unless you're in the job role. So the development of that AIPC certification was really exciting when it came out. And then I never thought of it in terms of a vendor maybe being able to take it. So that's really interesting and a very good point. So Sandra, also this year, right, is brand new, is the long-term care certification. So tell us a little bit about the development and the creation behind that certification.
Mm-hmm. Yes, we're really excited about being able to release this long-term care certification. And it didn't happen overnight. We certainly had thought about this over the course of the last few years when we started to look at pathways and what were perhaps barriers to some people becoming certified. We like to think of our certification, our CIC, being able to encompass everything. But we heard from the field that, particularly in long-term care, they didn't always see themselves reflected in our certification exam. But we don't just leave it on comments or feedback from that perspective. We actually went a deeper dive, and created a survey, a practice analysis to determine what's really happening. So these practice analysis are fundamental to actually all of our certification exams. We conduct these about every 4 to 5 years for the CIC. And so we decided to create a practice analysis and distribute it across North America to those IPs that are working in long-term care settings. And in essence, we developed a survey, we disseminated it, we analyzed that survey, and we actually looked at these results in 2021 and started to then realize we felt enough nuances, enough differences that we could create a certification exam that really speaks to those IPs working in a long-term care setting. And that's actually when we started to develop the test specifications and the questions over the course of 2022. So we're really excited that we have this product available, and we've had a really great response from the field.
Yes, I noticed that there are a few different knowledge domains that are different for that long-term care certification, such as specific elements to that setting, and then also the antimicrobial stewardship, which I think we don't typically see as much of on the CIC or the AIPC.
Mm-hmm. Yes, and also we have some questions more on ethical decision-making as well that we think are really important and poignant for that setting.
And Sandra, it's so amazing for you to note that the work for the long-term care facility certification, that work began before the COVID-19 pandemic, because even from my purview, I would have imagined that the certification stemmed from the COVID-19 pandemic, just based on the sheer barriers and some of the issues that were encountered within this within this healthcare space of the long-term care facility. So it's such amazing news to have this as an option now. So with that being said, how can people determine which certification is the best for them? You have individuals that have a CIC, so should they also take the long-term care facility certification? And in addition to that, say, for example, if someone has a long-term care facility certification, do you think that they would be able to qualify for a role that's requiring CIC certification?
Well, I'll start on this, and Tiffany can also respond to this as well, because it's important. As you said, there are some differences in the knowledge domains between the two, but many are the same. And we still look at microorganisms, we still look at transmission, but the settings that we describe are different. And so application of the knowledge can be adapted, but I think it comes up to the individual as well and what their personal goals and objectives are. And I think Tiffany has some great ideas about this as well.
Thanks, Sandra. Yeah, so the certification exam that we have been taking for a long time has a lot of those core elements that every infection preventionist needs to know, right? And then you take that information and you tailor it to your setting. The benefit of the long-term care certification is that it's very focused, so that it can help the person who is working as an infection preventionist in that setting understand the differences and nuances for infection prevention in a setting in which you're expecting to try to help create a more normal home environment, right? Because that's what our long-term care settings are. So when it comes to the practice of infection prevention, long-term care settings have a bit of a more nuanced approach to different things such as transmission-based precautions and how you respond to exposures or to clusters of disease or even large-scale events such as COVID.
Having hired people in the past, I know that certainly the employer may be very impressed with someone with a long-term care certification, particularly if they're a large organization with a long-term care home as part of the portfolio, not just acute care. But both are very adaptable. The knowledge and are applicable in both settings. It's just that one lends itself to the nuances of one setting more so than the other.
Definitely. And then I'm curious, what's been the feedback so far? I know that we're in the early days of this certification, but have you gotten any, good feedback? Is it effective the way that you wanted it to be?
Well, I can tell you that our beta testing, which we conduct when we create any new certification exam, was the response was remarkable. We had more than double the number of candidates taking the beta testing than we actually required. So that made us very confident that we had a good, robust exam that will meet the needs of certification. And going forward, we've had a lot of people anxiously waiting for that February 1st date when they could start to apply. So we are extremely pleased, I think, right, Tiffany?
Absolutely.
Oh, good. Yes, I've already seen on LinkedIn, people talking about it, and then the new initials after people's names. And so it's very exciting to see where this takes the field. So as far as questions, I know you guys have done a lot of education for the community about this new certification and really getting it out there on everyone's radar. So what are some of the common questions that you are getting about this process, both with the long-term care certification and the other certifications? And really, what are you wanting people to know the most? And where can we all go to find this information?
Great questions. So I think probably the most common questions are, am I qualified, right? Can I sit for the exam? One of the next questions is, which exam is right for me? And one of the third, I think, most frequent is, so once I've taken the exam and I've passed it, how do I recertify? And there are different nuances, right, between the criteria or the qualifications to sit for the AIPC, the CIC, and the long-term care certification. And you can go to the Certification Board of Infection Control and Epidemiology website, and there are some absolutely wonderful certification FAQs that there are a myriad of questions. So if you want to know along every step of the way, if you have a question about, what is the exam? What's the difference between the exams? Am I qualified? What are the benefits? Those questions are all answered under the FAQs on the website.
Oh, that's great. What about, what if I fail? What if I take this certification and fail? How long do I have to wait till I can take it again?
That is also a great question. Those are also included in the FAQs. For the AIPC, I know you have to wait 6 months. For the CIC, I believe it's the same for all three, correct, Sandra?
90 days.
90 days?
Okay, so some good study time in there.
Good vibes
For
to
sure.
everyone that's
For sure.
studying or preparing for their certification. So thank you for that. So my question is, Sandra and Tiffany, is twofold. So what updates can listeners look forward to from CIBIC? I know that we have these newer certifications that we're discussing, but what are some additional updates that we can look forward to? And in addition to that, if someone is interested in being involved in CIBIC in any way, such as far as volunteering, how can they partake in such opportunities?
Well, again, I think beginning with what we really want to make sure that people know and understand is that there are different ways, and what we're working on are different ways to reach these particular certifications. What is out there? What are access do they have to information and actually resources? And APIC is a great example of an organization that supports IPs or those who wish to get into the field of infection prevention and control, and helping them prepare for these exams. So that's one thing that I think we want to make sure that people know and understand. And that what we are trying to do is develop the other pathways for recertification, as Tiffany alluded to. We have educational units that people can accumulate over the period of their 5 years for their and actually submit that for recertification. So we're actually growing and developing more and more opportunities for them to receive educational units. And we are really open to thoughts and ideas from the field, but we hope to partner with an awful lot of our other types or other organizations out there, other associations that have great infection prevention and control educational offerings that we can also give people credit for towards their IPUs, as we call them, infection prevention units.
Sandra, that's so amazing. And I can attest definitely to the offerings that APIC provides, as I, was recently certified in the last August, just in being able to use resources, the educational tools that APIC provides, in addition to using the IP Talk and partnering with other IPs across the world in forming study groups and different things such as that.
And I think the other thing I really want people to remember is the value of certification for themselves. And this has actually come to the forefront for me anyway. And in the surveys that we've done, in the research we've done, we know that those of us who have received certification have just an overall self-assessed competency. We feel a little bit more confident, a little more empowered, and it's not just reflected in our own what we feel about ourselves. It's also reflected often in our salaries. They typically, those who are certified make about 25% higher in salary than those who are not certified. So those are just a couple of ways that there's some value of certification. I think it gives confidence to the employer who employs you, that they know that someone has some kind of standardized knowledge that's been tested and is reflected in the role that they're offering this person. So I think those things are really important to remember too, in terms of the value of the certification.
Yes.
That is definitely motivation for the adult learner, which may or may not be a question on the certification exam. My thought here next is, okay, so now we have the AIPC, we have the CIC, we're looking at a different practice setting with the long-term care, but what can we look at for the future? Are there going to be more specialized certifications?
So one of the functions of the board is to kind of evaluate continuously the needs of the infection preventionists, right? And we do that when we do our assessments for the CIC, for the LTC-CIP, the practice evaluations to really evaluate, where is infection prevention going, right? And some of those moves can be incorporated into the existing exams, right? So if we do a practice evaluation and we've identified that there is a new area that is more prominent focus, or an existing area that has more prominent focus, or maybe a new area that would be important to infection preventionists, smaller scale things could be incorporated into our existing exam processes. Sandra, I don't know if you have any thoughts on, future certifications. We do look at a large, a very broad swath of topics when we come together as a group.
Mm-hmm. Oh, yes. So Tiffany's absolutely correct. We do often have these conversations informally and formally within the board because all of us have been practicing in the field as well and have seen the evolution, if you will, of infection prevention and control over time. So, for example, I remember a previous job practice analysis done where suddenly there was a shift in the number of people who have research as incorporated into their role. And that in turn shifted the number of questions and that were asked in and around research and the development of research and study design and so on. So there, over time, we may see that. And as Tiffany's alluded to, we many times can incorporate that in our CIC, our primary certification in infection control. But I think we will really have to see down the road if there's a huge shift in one area, in one one type of setting that warrants such a dramatic shift as we saw with long-term care. There's a lot that was shifting us to realize there were more questions than we could actually incorporate into a single certification exam. And those are all the questions we ask ourselves at the board level.
Yeah, thank you for that. And I know that the CIBIC offers opportunities for people to possibly volunteer as far as item writing or, maybe other opportunities. Can you explain or expound upon that?
Well, we certainly have opportunities. And if you go to our certification website, or CBIC's website, you will actually see opportunities to volunteer and submit your resume, submit it forward. We were always looking for IPs who are certified, who want to give back and to want to be part of that process. So as from item writing with our 3 different exams that we're discussing today. That's just one area, or you might like to see yourself pursuing a board position as well. So that's where you begin. That's where it starts. So we really encourage everyone to take a look at the CBIC website.
That is great advice. And how fun would it be to help write the questions for the future tests? And I'm sure that you all do need a lot of help because that is a lot of questions to add to your question bank on a regular basis. Mm-hmm. So, we try to ask our hosts or our guests a question each time. We kind of stay standard with our question, but we were really interested to hear from both of you today about, what you're really looking forward to in infection prevention.
Well, Tiffany, do you want me to start? I think for me, infection prevention, let's just say the pandemic has put a spotlight on this field, more so
to put it mildly.
Yes. And it's for better or for worse, right? So we've probably always been in the background in our profession a little bit, and now we're in the forefront. And we have to figure out, what does that mean? Where are the opportunities for infection prevention control? And are there areas that still could use an expert in infection prevention and control within their type of setting? I don't think that that discussion would have happened pre-pandemic for some settings and areas where healthcare is still being delivered. So I think what I'm looking forward to the most is that there are continue to look at pathways for certification, because wherever we are delivering healthcare, I think people need to know that they have someone who has a sound, a foundational knowledge in this field and understands what they're doing and can share that with those who are delivering the care in the field. And Tiffany?
Yeah, absolutely. That's a great question. And I think my basic response is innovation, right? Innovation in how your very precious infection control resources can be deployed in a very wise manner, right? We still have limited resources. Innovation in different types of evidence-based research or guidelines or anything in which we can improve the delivery of care and improve outcomes for our patients through infection prevention and control. And, as Sandra stated, during COVID, it was a very challenging time, but we saw some of the brightest minds shine, right? When we saw some of the innovative things that they came up with to keep staff safe, to keep patients safe. And I think we have a bright future.
I love that, Tiffany. And I agree that, the innovation in the field and then the development of certifications like this will continue to propel the profession in the right direction. So thank you for that.
Thank you, Sandra and Tiffany, for sharing your knowledge regarding the offerings of CIBIC and the newer certifications that the organization has to offer. I so very much appreciate you all's time, and thank you for joining us today.
Thanks for listening to APIC's 5-Second Rule Show. We want to hear from you. Visit us at www.5secondruleshow.org. That's with the number 5, where you can contribute to the conversation. Make sure you subscribe and rate us wherever you listen to your podcasts. We're so appreciative of the hard work each of you do every day to make a safer world through infection prevention. Remember, IP stands for Important Person. You are awesome. Stay safe, and we'll see you next time.